It's a region of boundless landscapes, celebrations, and laughter. Community life is rich. But life in Malawi and Tanzania is rife with challenges. An overwhelming number of adolescents struggle with mental health issues. Poverty and violence leave young people feeling hopeless. Diseases like AIDS make orphans of many. The minds of young people here are scarred, and it is threatening the delicate pace of progress in this region.
We are saying we are building the youth to be the next leaders. So if we have youth who are mentally disturbed, who are stressed, how do we have good leaders?
In a country where 2/3 of the population is under 25 years old, that question has huge implications.
We're sitting on a time bomb. There's not much effort to address the mind.
It's difficult to find Umodze Mizere without a book in his hands. The young pastor says they help him think. They help clear his mind. Strolling through his garden, he finds the sort of peace that is incredibly important to him, because there was a time in his life when his mind was in constant turmoil.
Like the first time I started having mental health problems, I was 14 years old. I used to struggle a lot with suicidal tendencies.
It's been a long journey for Umodze. It took almost a decade for him to find any help.
I used to have a lot of mood swings and depression. I was also violent. And I didn't really know what was happening to me. And I look back, when I look back at it, I thought I was a freak.
Umodze was eventually diagnosed with bipolar disorder. He received medication and counseling. It's help that has changed his life, and he's one of the lucky ones. His is one of Malawi's more prosperous families. They understood his behaviors as a sign of mental illness, and that is a rare exception in these parts.
If you go into the villages, there are not many places where where you can go, they can address a mental health issue, or someone can diagnose you.
Agnes Mizere is Umodze's sister. She's a news reporter who has spent most of her career covering the impact mental illness has had on her country. She says the country is losing young minds to mental problems that are easily treatable.
We're kind of like in the Dark Ages, where they believed that mental health was because of demons.
News reports are starting to shed light on a big problem.
Did you also believe?
Yeah.
You believed it was the devil?
Yes. We had that mindset, as I said, based on our cultural setting.
A lack of understanding about mental health is leading families to take their affected family members to traditional healers or witch doctors, performing ceremonies to banish demons.
Hadiza was hearing voices telling her to harm herself. So her family handcuffed her and brought her here to Amina Ali.
When exorcism fails, stigma persists and isolation follows. But until now, there have been few alternatives. There's only one psychiatrist for the entire country. The situation is almost the same in neighboring Tanzania, where mental health care has been, until very recently, virtually non-existent. There are 50 million people living here and only 35 psychiatrists dealing with the very worst cases.
People are not aware if these are symptoms of mental illness unless it is very severe. People can tell. So that is one of the biggest challenge ever.
Dr. Omari Uvuguyu is part of a new approach. He's a government psychiatrist who has been appointed to work with a Canadian program addressing treatable mental health issues in the early stages, particularly among young people.
Majority of cases occur between that age of 12 to 25. And this is a time where we learn. In the future, we'll be having a nation which has a very big problem because most of the youth didn't get appropriate knowledge simply because they had a condition which is treatable, which is manageable.
Dr. Uvuguyu's Canadian counterpart is Dr. Stan Kutcher, the World Health Organization Mental Health Chair at Dalhousie University. Together, they're adapting Dr. Kutcher's highly successful youth mental health training program to work in an African cultural context.
Mental illnesses are disorders of brain function. If we really want to help people be successful, we really have to pay tremendous attention to helping them use their brains as effectively and efficiently as possible.
Through a partnership with Farm Radio International, Kutcher's program has trained hundreds of frontline health workers in rural areas of Tanzania and Malawi to treat anxiety and depression.
We're creating literacy with the teachers and the students, and then linking that to having care available for them in their communities.
Change is coming, and it's coming quickly. This is a mental health rally in rural Malawi. Farm Radio has been instrumental in putting together many such rallies. An awareness-raising event like this would have been unheard of 2 years ago. Now, they're drawing more and more people.
We're having a massive radio campaign designed for teenagers in each country that's about mental health and mental illness, with a focus on depression and raising awareness about the issue of depression. We're also training teachers and peer educators in secondary schools to integrate a mental health curriculum into the schools and teach students about mental health and get them into care and get treatment for them.
For nearly 4 decades, Farm Radio International has been helping farmers in developing countries grow healthy crops. Now, their work is expanding, helping farming communities to make sure their children grow up healthy as well. Watching a schoolyard soccer match with dozens of young smiles, you might think these children are growing up happy and healthy. But beneath some of those smiles is a lot of torment.
I feel I'm alone, that's why I want to kill myself.
Kefas Konex's father died of disease. He witnessed his best friend beaten to death. He's thought of taking his own life several times.
I want to be alone. Most times. Also at home, be alone. To avoid misunderstanding with other friends.
Kefas began acting out and isolating himself from others. Not too long ago, that would have led to physical discipline and expulsion from school. But Kefas's teachers had received mental health training from Farm Radio's partnership with Dr. Stan Kutcher. So they brought him to the newly trained mental health counselors.
We just had no idea, and we really didn't think that we would have that much of an impact.
I was surprised. The time is very short, the impact is significant.
Farm Radio has created a social safety net where there was none. A community where people like Umodzi now feel brave enough to share their stories in front of hundreds of people.
I want to tell you my testimony about my struggle with depression.
And inspire others to seek the help they need.
I don't know, you're not a freak. It's just that it's a condition that is treatable. If you dare to be vulnerable, you go talk to somebody about your challenges and your problems. We never know. Struggling with depression. That's the most important thing. Hope is medicine for the soul.
Inu Aba